Chris Joseph, I know you're up next. Go ahead, sir.
Hey, Dr. Traxler. So DHEC is obviously encouraging masks, and as you referenced earlier, it has the power to enact rules in response to a public health emergency. Why has DHEC not taken that step in unilaterally enacting a rule to either enforce masks or instruct school districts to have masks as a mandatory situation on their campuses?
So, as I noted earlier, it would be this authority that we do have, as you note, is really intended to be used for local situations to get a situation under control where there's imminent danger. And I'm not saying that there's not imminent danger regarding COVID-19, but in this situation, it would be difficult to apply a statewide order equally to all schools, school districts, when again, all of them are in different situations. And so as a result, we recommend that the legislature considers revising their proviso to let those individual different local school districts and school leaderships make the decisions about masks or mask requirements.
Judy, go ahead, please, ma'am.
Thank you so much, Dr. Traxler. On this note of dealing with misinformation, a Facebook post has landed in my inbox several times today, and I'll just read it to you so that you can respond to it directly. I'm not going to use a name, but it's from a parent in Lexington, Richland 5, where we're having a lot of pushback, obviously, about the protocols that DHEC has issued. The post says, "Stop getting your kids tested for COVID. The tests are unreliable. The quarantining is stupid and pointless. We need to be treating this like we treat the flu. If your child has a fever or just plain puny because they don't feel good, keep them home like a decent parent. Stop living in fear. By the way, all these new variants they're talking about cannot be detected from any test. It's all a bunch of BS. Stop listening to the lies." There's a lot to unpack there, but the main things I'd like for you to address are the concerns you would have about parents adopting this strategy to stop testing their kids, and what we've heard over and over again about people characterizing this as being the same as the flu.
Sure. So the biggest difference between this and the flu, I would say, in terms of how it applies to testing and contact tracing and the need to quarantine and such, is that with the flu, you're contagious while you have symptoms. So before you develop that fever or that aches, not feeling well, that feeling puny, you're not contagious, and there aren't people out there who are potentially spreading the flu who don't have symptoms. With COVID-19, we know that you can be asymptomatic, meaning not have symptoms at all, and still be contagious. We also know you can be pre-symptomatic, meaning before you develop your symptoms. So we would be missing a number of people who are contagious if we were only asking folks who had symptoms and who had them at that point in time to stay home. That is also part of the importance of testing, not only to identify if symptoms you have are due to COVID-19, but to identify pre-symptomatic or asymptomatic folks, especially who are at high risk because they have been exposed as close contacts. The tests that are out there right now do identify the variants that are currently out there. They can tell separate viruses apart, and they can identify the different. So by that I mean you're not testing positive because of another virus. If you test positive, it's because of the SARS-CoV-2 virus, the one that causes COVID-19. And so far, the mutations that are in the variants are not ones that have changed the test's ability to detect the virus.
All right, Zaria Jeffries, Post and Courier, please go ahead.
Thanks. Hi, Dr. Traxler. Given that proof of vaccination is like a looming topic, what are people doing when they lose their vaccination cards?
Sure. So I'm not, excuse me, I'm not certain with the looming topic, but in general, anyone who needs proof of their COVID-19 or other immunizations can go through DHEC and request an official copy of their immunization record.
Thank you.
Chloe, go ahead, please, ma'am.
Hi, thanks so much. A school in Fort Mill just announced that they are transitioning to virtual learning tomorrow after COVID spread within the school. So does that surprise you? How could this have been prevented, and how will this impact those students? They've only been in the classroom for a week and a half. Thank you.
I not knowing about specific situations makes it difficult for me to respond. We know that that the spread of COVID-19 can be slowed by people who are eligible getting vaccinated and by everyone wearing a mask when they're indoors. And so if schools and school districts and parents and students and teachers and everyone are wanting to prevent outbreaks or significant numbers that are driving them to go to virtual, then the best thing people can do is to take these two protective actions.
Thank you. Tai Wong, please go ahead, sir.
Hi, Dr. Traxler. So I was wondering, can you kind of talk about how many children, to your knowledge, have been hospitalized with COVID in South Carolina? And if you don't know the exact number, what can we learn about the effects that you've seen on children so far with the Delta variant?
So sorry, I don't know that number, that total number off the top of my head. We do know that we are seeing more cases, as I noted earlier, I think in response to one of the first questions in the pre-submitted ones, that we're seeing younger people as a higher proportion of our cases. And this is likely due to the fact that they either are not eligible or are not getting vaccinated. And as I noted, when you also put children whose immune systems may not be as developed as an adult's into close quarters, that also increases the potential for contagious diseases to spread. We also know that Delta is more contagious. It's more infectious than the original COVID-19 strain. And so all of these allow for there to be more transmission and spread between and by children.
Thank you. Kate, please go ahead.
Hi, Dr. Traxler. So when looking at trends this winter and this fall, do we believe that COVID will still be an issue and the trend of the Delta variant will have gone down after the typical 8 to 12-week reign? And if so, are we worried about the twindemic with the flu and COVID-19 as universal masking isn't in schools anymore?
So much of what happens in the future is to be determined, and a lot of it is to be determined by all of our actions. If we get significantly increased vaccination rates and we get a large proportion of South Carolinians who are eligible vaccinated, and we all take some of those basic precautions, especially in the meantime, that we know work, like masking and physical distancing, we can change the direction of this and see a decrease in cases. Otherwise, certainly there is the potential and concern for seeing this and flu overlapping, just as there was last year. And the fewer protective measures that are being performed by people, then the higher risk that is, combined with having variants out there that are more infectious and more easily spread. We could continue to see higher numbers that do overlap with the flu, which is concerning.
Jason, please go ahead.
Hey, Dr. Traxler. Just got a quick question. We've been talking to hospitals pretty much all week up in the upstate and in the Midlands just about their current situation. Do you anticipate a potential need to, whether it's waive certificate of need laws again, like we did at the start of the pandemic, to kind of help these hospitals deal with this current surge of hospitalized patients?
So we are, working with all of the hospitals and with the South Carolina Hospital Association very closely, and we will work to do everything we can to help hospitals if things are needed, such as various waivers or being allowed to do various alternative sites.
Chris, you have a follow-up.
Yeah, Dr. Traxler, so going back to our conversation from earlier, you reference each situation is different. If we've got high spread statewide, I guess what would be different about these different districts across the state?
Sure. Well, you have different levels of mask use voluntarily, even already among different schools and different districts. And so you also have different vaccination rates among the students and staff. Those are the two things that immediately come to mind.
Zaria, go ahead, please.
Sorry, I didn't know that was still on. No question.
All right, no problem at all. Judy Gadsden, please go ahead.
Thank you very much, Ron. Dr. Traxler, I wanted to follow up on that recommendation that you and Dr. Bell and Dr. Simmer made to the board last week about requiring masking, adding that to the guidelines. And I understand your answer that you gave earlier, saying that, you know, different school districts are dealing with this in a different level, and a statewide order would not be appropriate because there are different scenarios. But does DHEC have the authority to issue that order for a particular county versus statewide?
And so that is something I would need to defer to the lawyers about. But I know that we do, when we have this authority, its indication is to be used for local situations. So that is potentially the case. So, but again, I would want to verify with somebody whose expertise is in that area.
Chris, go ahead again, please.
So to follow up on Judy's question, and very well may be the same answer, but state law references the idea that once you guys promulgate a rule, it would have to go through the General Assembly. Would that be the same process for the situations that we are talking about here?
So in general, some of the processes, and again, not talking about specifics because I'm not a lawyer, but in general, different processes for rules and regulations and such by DHEC go through different mechanisms. And again, it can be dependent on whether it is an emergency situation or not. But again, the details I'd have to defer to the lawyers.
Judy, go ahead, please, ma'am.
Dr. Traxler, you mentioned earlier that people who have been vaccinated can get that proof from DHEC. Can we get the information? And if it's easier for Ron or the team to email after, if we can get that information, I'm getting that question from a number of viewers as well about the best way to submit that request, or email or phone number.
Certainly, and we'll have I'll have Ron and the team follow up. It is the same mechanism you'd go through if you were getting your vaccination record for school entry, for example. But not wanting to give you any incorrect information, I'll have us follow up with the details afterwards to make sure it's
Thank you very much. Appreciate it.
All right, we are at 2:42. I want to thank everybody. Dr. Traxler, thank you for your time. Thank you for all of our wonderful media present today for your valuable time and your continued coverage of the COVID-19 pandemic in South Carolina. Take care of yourselves.